If you're old and you have arthritis and you have achy pains and achy joints, try changing your diet before going to medication. I will add, I have helped a lot of people who think that their pain is due to arthritis. If you're 30 years old and you were told that you have pain because of your arthritis, unless you've had a crappy diet, I would think the physician who told you that is blowing smoke. Unless they did an MRI or an X-ray, you cannot tell formally if there is arthritis in a joint. Hello and good morning or good day, good afternoon, whatever time of day you're listening. We welcome you to Straight to Health podcast on this lovely Saturday morning. My name is Dr. Gavin Hall. I am the owner of Straight Up Chiropractic in Southern Utah, and I am here to educate you on your health. My goal is simply to help you learn something new, either help you save a couple bucks maybe to learn something about your particular injury, or maybe you heard something from a doctor or physician that you didn't quite agree with. Let me try to explain why I want to educate you. You have control of your health, make a decision, and find the correct physician, the correct treatment for your problem. Okay? We're going to get started. Today is on the hip and thigh. All right, injuries of the hip and thigh. Many of these injuries today that I'm going to cover are very much, you might need to go see a orthopedic surgeon for. There are many hip injuries that I've been able to help, and I'll cover some of those. But unfortunately, the hip is one of the more difficult, I wouldn't say difficult things to fix, but there are a lot more things that can go wrong with the hip than other joints. All right, just like the shoulder. We're going to cover the shoulder in a future episode, but the hip and the shoulder, they are the two, what we call ball and socket joints of the body. And because of how, if you think of a ball and socket joint, of how loose it might be, because it needs so many more things to strap it and keep it in place, as a result, there are a lot more problems that can happen with that as well. All right. Today we're going to be covering, there are 13 different ligaments in that hip, and there are 21 different muscles that will cross and affect the hip. So let's go ahead and get started. I want to start with Piriformis syndrome, one of the most common things I think I treat. It's typically pain on the backside of the hip. You can often have sciatica that runs down the back of the leg. Sciatica is a very vague term that just says I'm having tingling in the back of my thigh. All right. Oftentimes it's caused because of either a back thing or a piriformis thing. Most commonly, piriformis syndrome is because the piriformis gets so tight that it pinches the nerve, the sciatic nerve, and that pinch, if you think of a nerve like a hose, not the best example, but it's the best one I've got for now. Think of the nerve like a hose. And as you pinch the hose, you're going to have less water coming out of it. If you have less water coming out of the nerve, then you're going to start feeling things, that trickling down sensation, that you're losing sensation and feeling of the rest of the leg because it's pinched off. All right. So that piriformis syndrome is this muscle. It's the only muscle that the sciatic nerve will actually puncture. Most common, I would say. There are probably exceptions to this rule, but as a whole, the sciatic nerve will go in between the piriformis muscle. And if the piriformis gets tight, if you think of pulling a band tight or a rope tight, then it's just going to chop off or kind of occlude blood flow and flow to the nerve in general. That's what they consider this piriformis syndrome. It causes that sciatica down the leg, but we can get some significant changes if we get the piriformis working, the quadratus femoris working, a bunch of the other deep hip muscles, the obturator internus externus, get the glutes working to help distribute that load. Oftentimes because, in my opinion, most people will say, let's just loosen the piriformis syndrome or loosen the piriformis muscle. Yes, that will help. It will often provide temporary relief because the tight muscle is now relaxed. But in the grand scheme of what I get to treat of AMIT or muscle activation, we treat muscle inhibition. That's what we're fixing. The inhibition of the muscle is, in previous episodes I've described this, so if you need it in detail, definitely listen to a previous episode. But inhibition happens to a muscle because of damage, trauma, other things. When that muscle shuts down, other muscles have to take the load from the shutdown muscle in compensation. The piriformis is great at compensating. So if you shut down your glutes because of something that you did in a workout, or you fell down the stairs, or other things that will shut down your glutes are very strong muscles. Your deep hip muscles, like the piriformis, are not strong. They're more stabilization muscles. If you think of it like the rotator cuff for your hip, your rotator cuff muscles do a lot of more stabilization than they do strength. All right? Your big gluteus maximus is going to be your strength bringer. If the gluteus maximus is not working, these little tiny muscles have to try and do the job of the huge ones. All right? So if you have the piriformis that's pulling super tight because it has to do the job of this really big glute maximus muscle, then yeah, your piriformis is going to get really, really tight, and it's going to pinch this nerve and shoot symptoms down your leg. All right? We turn on the glutes. We turn on other muscles. It redistributes that load off of the piriformis. Then you can get some long-term relief. All right? So I know your massage gun is going to help as well for the sake of short-term care, but if you need and want long-lasting, long-term care, then let's activate the muscles in your hip and get the piriformis syndrome gone completely. A lot of runners will have this problem because if their glutes are not working, then the piriformis is going to tighten up with all the runs that they go on, and it's going to cause pain down the leg. Let's get your glutes working, all right? So that's your piriformis syndrome. Let's move on to the next one. A strain. A strain of the muscles in the groin. When we say groin, we mean adductors. Adductors are the muscles that connect from the inside of your thigh up to your pelvis or groin area. All right. If you strain, I think we've covered this in previous ones, a strain versus a sprain. Strain applies to muscles, sprain applies to ligaments. All right. So if you strain a muscle, it's because you over-contracted or overworked the muscle to the point where it said, and it tightens up really good and it hurts really bad. And the easiest way to fix it is to redistribute the load. Just like I explained with the hip, the adductor muscles stop working, all right? Because you've overdone it. They're now pulling super hard, and we need to redistribute that load. So the quads will typically take the load from the adductors. We get the adductors working again, and the strain is like it never happened. So oftentimes, if you were to strain your adductor or strain your groin muscles, then we can fix that in just a couple of visits or less. Another thing, people call this I pulled my groin muscle. I have groin pain. I have adductor strain. There are a couple of different words for this, but they're all just going to be pain along the muscles of the inside of the thigh. I don't know if you can see my little picture here. Let's see if I can show you what this looks like. But the idea with this is that any of those muscles can become a problem. All right, or strained. If you have a full muscle tear, very uncommon in the adductors and the groin, but any muscle is possible to have a full tear. All right, the difference, the strain, is it pulls tight. The tear is that it rips. If you think of the rope, some of the fibers might have frayed, but it's still connected. If it's a full tear, that is not up my alley. You will want to get that surgically repaired. Then we can work on it. I had a gentleman just last year, for the sake of his hamstrings, he's a bull rider, and he tore his hamstring, full tear. The hamstring came off of the bone, as you might imagine, when he's trying to hang on to that stinking bull, and with his heels, and the full hamstring just tore off the bone. He had to go get it surgically repaired, and after the surgery, he says, I don't know what the heck has happened, but I cannot get my hamstrings to work for the life of me. I can't hang on to the bull anymore. There's no strength in my hamstring at all. It's because once the muscle is torn, it becomes inhibited. All right. If we can reset or reverse the inhibition, the muscle can contract again. But if it's torn, I can't help with the tear. Go get it fixed. I want to reverse the inhibition of it so it can contract fully again. All right, that will do you a lot more in the long run for the sake of strength, rehabilitation in that muscle. And that applies to the adductor. If you've ever torn, I've never heard of a torn adductor, a full tear in an adductor. But if it happens, get it surgically repaired, and then we can reverse the inhibition that comes with it. All right. If you just strained the adductor, if you strained your hamstring, pulled your hamstring, you pulled your quad, you pulled your muscle, If you feel like you pulled it, we can fix that relatively quickly. I don't think I've seen anyone more than 2 times for a pulled muscle. All right. We just have to redistribute the load from previous injuries. Usually it's a compensation thing. We get through those pretty quickly. Which brings me actually to my next injury, hamstring. Oh, I never finished my story. So this bull rider, he comes in after tearing his hamstring. He gets it surgically repaired. We reverse his inhibition in the muscle, and he went and he's been doing very well now in the rodeo realm. There's actually another great story of a rodeo person. I'll probably share it with the shoulder, but I want to share it now because it's on my mind in case I forget. Super cool story. One of this bull rider, after I treated this bull rider with a hamstring, he's like, oh my gosh, this is pretty cool. And he sent someone else in, and he had, I think it was a shoulder. He fractured his arm, his humerus, during a bull riding incident, I believe. And ever since then, he has lost strength in his arm and his hand, and his left hand is the hand that grips the bull. And he's like, ever since I broke my arm, I can't stay on the bull worth crap. And we were able to re-engage the muscles of his arm and his forearm, and I believe he went on and did very well in his last competition. I think they call it a competition. Maybe I'm using the wrong words here, but it was super fun to see him excel in his sport and do what he loves to do after re-engaging some of those muscles. So if you've ever had an avulsion tear, which is when the muscle pulls off of the bone, or just a muscle belly tear, a muscle tendon tear, any portion of that muscle once it's torn, get it surgically repaired, let it heal, then we reverse the inhibition, all right? That covers the strain, that covers the adductor. You can have something called hip bursitis. We covered this a little bit in the knee, but a bursa is something that goes between bone to prevent those bones from rubbing on each other, all right? In most of the joints, you will have the meniscus in the knee, for example. You'll have the acetabulum in the hip. We'll cover that one. I think it's next. No, it looks like it's down the line a little bit. But you can have injuries in the acetabulum. Those will keep, like in the joint space from the bones pushing on the bones, and it keeps those bones from rubbing on each other. The bursa is to protect often muscle, or in the knee, it was the kneecap, but often is to protect muscle tendons from rubbing on those bones as well. Because if you think of the muscle like a rope, I probably said this a million times, if you think of the muscle like a rope and it chafes on these bones, then you're going to start having muscles fraying, and you're going to have pain, you're going to have friction problems, you're going to have all sorts of injuries when you're trying to use those muscles while they rub on the bone. Bursa, God gave us a bursa to prevent the friction. All right, it goes between that muscle, the tendon, the IT band, for example, and it prevents that IT band from rubbing on that femur head, what we call the greater trochanter, so you don't have that pain there. All right, it's just a squishy little sponge, if you think of it that way, that keeps the tendon from rubbing on that bone. But the hip bursitis, we can treat that. That's relatively a quick thing. That's typically pain on the outside of the hip. It can be on the butt bone. You have bursas right there as well. You have bursas on the inside of the hip where your adductors kind of come up on the inside of the hip to rub on the joint. But we can treat almost all of those. I had one person who I was not able to fix with this hip bursitis so far. And it was a gentleman. After 4 visits, I typically say, hey, if it's not getting better, let's do an MRI or an X-ray and find out why. This particular gentleman, he came 4 times. And true to my word, I said, let's get an MRI and find out what the heck's going on. He got an MRI. Turns out that he had degradation of his bone. I can't fix a bone problem. I want to fix muscle problems, all right? So this guy had an infection in his bone. It started to fall apart, and I thought, well, that makes pretty darn good sense why your bursa is inflamed and that I can't fix your pain. But he turns out that he had a bigger problem than I was able to help. He went and got some good help for it, and of my knowledge, he's doing well. But I also haven't followed up. He hasn't needed me since he got the other stuff repaired surgically. So that was kind of a fun little, we can treat hip bursitis. If you got some pain in your hip, let's get it done. You do have hip osteoarthritis. I believe I missed this in the previous episode when I did the knee. But I want to cover arthritis just a little bit. I covered it, I think, as well in the episode I did on AMIT or muscle inhibition. But arthritis is inflammation of a joint leading to malformation of the joint, wear and tear, degeneration. You get growths that come off the joint if it gets super bad. You'll see it very obviously in older ladies, I would say, are more common. Their knuckles become all bigger in the hand, and sometimes their fingers will start to change different directions. But the idea of arthritis is inflammation. It's an unhealthy joint. The most effective way that I have seen to help arthritis is clean up your diet. All right, it's inflammation in the joint. Let's get rid of the inflammation by cleaning up your diet. Sugar being the most common form of inflammation, the source of inflammation. All right, stop your 48-ounce Coke. I don't know about outside of the state. If you're listening from outside of the state, in Utah, we have so many soda shops. I can't impress upon you how frustrated I am with how many soda shops there are in St. George, but they make good money. These people who walk around with their 48-ounce Cokes or their dirty Dr. Peppers, whatever you want to call them, when I have to tell them that they're going to have some significant problems if they keep ingesting that much sugar, you would think I shot them in the foot, because they love their dirty soda. Don't take it away from them. But it will be the easiest thing that you can do to reduce the likelihood of arthritis in your body. If you're old and you have arthritis and you have achy pains and achy joints, try changing your diet before going to medication. All right? I will add, I have helped a lot of people who think that their pain is due to arthritis. If you're 30 years old and you were told that you have pain because of your arthritis, unless you've had a crappy diet, I would think the physician who told you that is blowing smoke. Unless they did an MRI or an X-ray, you cannot tell formally if there is arthritis in a joint. But oftentimes, if you change the diet and we get some good muscles activated in the knees or in the hips, this case is the hips because today is about hips, or in any joint, you re-engage the muscles, you correct the function of the joint, you decrease the inflammation by your diet, and the pain will go away. You might still have arthritis in the joint, but the pain is what you care about, right? If you can get rid of the pain in the knee, I don't care about the arthritis. It's like scoliosis. Oh, I've got scoliosis, but if the pain is from the scoliosis is gone, in my opinion, the scoliosis doesn't really matter, all right? Unless it's impeding significant parts of your health, but that's when it matters. If it doesn't, anyhow, I think I've hit that one a little bit. But if you have arthritis, I would love to work on you to try and prevent you from getting a knee surgery or a hip surgery that is unnecessary. You know that is the end result. If this doesn't work, if everything that you've heard about doesn't work, then resort to surgery. But you know that if you do the surgery, what's next? There's not much next after surgery. So why not try these other things and then get to surgery? If you try the surgery, or if you've had the surgery, and if it's ineffective or didn't give you the results that you wanted, then come in still. We know that the arthritis isn't a problem, so it has to be the muscles that are not pulling across the joint. All right? So if that fits your bill, I would love to work on you, see what I can do before you give up hope on your hip or before you resort to surgery if you haven't already. All right? You know that's where you're going to go. Why not make sure that's the very last step before you? It's the same thing with the knee. But that's kind of your osteoarthritis, your arthritis in general, degenerative arthritis, degenerative joint disease, DJD, OA. There are different names for arthritis. There are different forms of arthritis based on the actual cause. Most arthritides, I would say, are corrected by your diet most effectively. Okay? We have something called hip avascular necrosis. This is something I cannot fix. Avascular necrosis to any joint. It's pretty common in the hip, but to any joint is when the blood supply to the joint has died. Bones need blood to heal and to stay healthy. If your bone is not getting blood supply, then the bone will start to die. If the bone dies and you try and stress it or put some weight on it, then the bone often will collapse because it doesn't have that structural stability from keeping nutrients in it. It collapses and you've got a problem. For the sake of the hip, this is most common a problem if you've fractured the hip or if you've dislocated the hip, because when that fracture dislocates, it can sever some of the blood vessels that go to feed the hip. And if those blood vessels are severed, then the future problem is going to be the lack of blood flow. It degenerates over time and it just collapses one day. So make sure that's not your problem. I can't help with that. That will be a surgical repair every time. That will be your hip replacement likely. Then we have something also called leg calf Piriformis disease. It's very similar. It's malformation, or your bone didn't keep growing. Most common in kids, but your bone didn't keep growing likely because of lack of blood flow. You're going to need to get that one surgically repaired. All right, there's different levels and severities of it, but that leg calf Piriformis disease, it's also called Piriformis disease, osteochondritis deformans juvenalis, and ischemic hip necrosis. Necrosis is dying tissue. So if your tissue's dying, that is not up my alley. Get someone to fix that for you. All right, then we have myositis ossificans. That is calcification that occurs at the site of the injured muscle, most commonly the quadriceps muscle. It's about 80% of the time. But it can also happen in the buttocks, the shoulder. It can happen in the calf. It can happen at different areas. They call this multiple different names for it as myositis ossificans traumatica, ossifying hematoma, and heterotropic ossification. Most people, when I start reading off these words, they're like, wow, this sounds like Harry Potter. If that came to mind, don't worry, it came to mind too. Now, this one is not fully understood why it's a problem, how it comes on, but it's that you have this calcification that happens in the muscle and that causes pain as the site of the muscle attachment becomes inflamed and kind of hardens over with bone. It's just the myositis, myo being muscle, itis being inflammation, ossification is the process of bone, of the process of becoming bone. Ossification. So it's the muscle is kind of turning into a bone, and they don't know completely why it happens and how to fix it. That is also not up my alley. If you have pain from it, I'd be happy to work on a couple of muscles and see if we can help with the pain, but there's no current information on how to correct that. If I'm wrong, please let me know. Send me a message, send me an email, update me. My book is, as of, I think it was 2020, my book is up to date. We're looking at 5 years from now, right? But books often take time to publish and get the right information in them. And even then, I'd say that a lot of information in books can be questionable. So, septic arthritis of the hip is very similar. Bacterial infection, that septic being you have an infection there. Anything septic, then I can't fix that. You're going to have to go and get the joint cleaned out, and make sure you don't have any diseases or bacteria or viruses left in that joint, all right? So that's going to be some significant pain. If you get like a severe amount of pain with most of these previous, 3 or 4, that'd be a severe amount of pain. Go get an x-ray. The x-ray will tell you a lot. If you do a couple of visits with me and we didn't get any improvement, like those 4 visits that I typically recommend, and there's no improvement, I'm not looking for 100%. You don't have to be 100% better. What I am looking for is 20, 50% improvement. If there's none of that, then definitely, regardless of the physician you're seeing, if you don't see improvement, go get an x-ray and find out why. Go get an MRI. We then have something called the slipped femoral epiphysis, or SCFE for short, SCFE. SCFE for short. That's displacement or a fracture of the head of the femur. If you think of the femur kind of like this, your femur here, and the head comes up to be in your hip here, your socket. What happens is often the very top of the head of this femur, where it rubs on the bone, will just slip and it breaks. The top of it, if you will, just breaks off of, it slips off of the femur. It's a really weird phenomena. They think it's due to an increased stress if you're young, most commonly like a 10 to 16-year-old. those young ages when their bones are still healing, if you don't have the right nutrients in the body to encourage that bone growth, and you put some significant stress on there because of your sport, I would say it's an athlete, but you put a lot of stress on there, you're jumping on the trampoline, for example, and you just have this hip that kind of gives way and then you collapse and there's significant pain, you're probably right up that alley. Don't spend time in my office for that one. Don't spend time in anyone else's. Go straight to an X-ray. Go to the ER and find out what the heck's going on there. But those typically require either a long time of bracing or can, in severe cases, require a surgical repair. All right. Then we have something called snapping hip syndrome. This one's kind of a fun one. This one is also known as coxa saltans. It's a hip syndrome that is characterized by a repeatable, audible, or palpable snap or click that occurs in the hip during motion. If it doesn't hurt, I wouldn't say that it's the biggest deal, but I have helped a lot of people with snapping hip syndrome just by re-engaging other muscles. We talked about it kind of earlier in this episode. If that muscle is really, really tight and snaps across different things because it's so tight, let's distribute the load off of that muscle by re-engaging other muscles, and the snapping hip syndrome disappears. And it's the craziest thing in the person's eyes. I'm like, well, let's think about it. We're just distributing the load that's causing too much stress on this muscle. So just be aware of that snapping hip syndrome. If you hear like a clicking, popping, or a flipping, or a snapping in that hip when you move it, let's work on it. We could probably get some significant improvement there, okay? We have transient hip synovitis is next. That one's just going to be temporary hip joint capsule inflammation. It's most common in 3 to 10-year-olds. It's typically from all that overuse and stuff like that. They have a lot of different names for this one. You won't need to know, nor have you probably heard any of them, because more than half of them, they're out of my scope anyway. But the idea is that you just have inflammation of the synovium of the hip. Synovium is the joint space between the two bones. Okay, and so you can get inflammation in there if it's not healthy, if you've overdone it, if you've inflamed it. In my opinion, I would say that the overinflammation comes because you have a bunch of muscles that are not doing their job. So let's restabilize that joint and make sure that the muscle, that joint is stable by distributing the load onto more than just a few muscles. You have then, we talked about labral tear. We're finally there. Labral tear is similar material to a ligament, okay, except the labrum is responsible. It's kind of like a cushion that is going to keep your femur and your hip from being bone on bone. It's a little bit more firm. It's softer than a bone. It's almost like a cartilage style, but it's more, I think they classify it technically as a ligament. The acetabular labral tear, if you've torn it, you do need to get that repaired. It's going to be a pinching. If you flex your knee to your chest, you can YouTube this, but to check for an acetabular or a labral tear, flex your knee to your chest and kind of rotate your hip outward, or have someone do it for you so you're not using your muscles. And if you can get some significant pain when twisting that hip while your knee is flexed, then it's putting pressure. What it does is that while you put it in there, if your hip is going like this, and then you flex the hip, and then you rotate it, it pushes a lot on the labrum in the joint, and that's what causes pain. Is because if you think of, it's not the best example, but if you think of your labrum a little bit like a donut, I typically will describe it as a donut. It's not the greatest example, but if you have the outside of this donut, that will rip because you compressed the outsides, and the nice squishy donut has a nice firm outside, then the donut will tear because of the tension that you're adding by pressuring the donut, the top of it, right? So the sides will kind of stress and they'll tear. So what happens is we're testing, if you did over pressurize this labrum and it tore, then what we're doing by flexing the hip and rotating the hip is by pushing on it a little bit more. And if it causes that to rip even more, or to pressure the fibers that were torn, then it says, yeah, we've probably gone into this labrum tear a little bit. I would be careful, though. Not all symptoms that you will get from flexing your knee and rotating your hip are because of a labrum. I've fixed a lot of hips that did cause pain initially in that motion, but then didn't, and afterwards. after we treated it. So I should say that did cause pain initially that were not labral tears. So a lot of the tests that many of the tests that we have in the knee and the hip and the body in general that say, okay, I think this is going to be your injury, it doesn't mean it's always the case. That's just the best way that we've found to test it to increase the likelihood of it being that injury. All right, that's what orthopedic tests are for in general, is they'll say, okay, this isn't a home run, but based on what this muscle, ligament, structure should be doing, I'm going to try my best to stress that one and only that one. That way it kind of gives us an answer about what could probably be the problem. So that's kind of the purpose there. And not all of those tests, if you get pain during some of the hip flexion tests, it doesn't mean that your labrum is the problem every time. It just increases the likelihood that it could be coming from the labrum. So just be aware of that when any physician is telling you that, well, based on the exam I did, this is going to be your problem. Well, if they didn't do an exam, then I would be quick to doubt them. Make sure that they're messing with the joint. Make sure that they're pushing those ligaments, pushing the muscles to find out a little bit more about what's happening in that joint for that injury, okay? But I think that covers acetabular labral tear. Get it surgically repaired. It should be just a simple stitch the two sides back together, and we can get some good improvement for the sake of inhibition that comes with the muscles afterwards. That tear will inhibit muscles, and we'd re-engage the muscle function after that tear to make sure that you can go back and do your sport relatively normal. All right, well, then we have inguinal and femoral hernias. Hernias are not in my realm, but they can cause hip pain. All right. The simple version of how to describe a hernia is that you have areas in your body that have holes in them for the sake of blood flow, and nerves need to go through. So let me just explain this differently. Your abdominal wall, okay, you have these abs, but when you were born, you had this umbilical cord that came into your belly that punctured through your abdominal wall in order to feed your body, all right? But the abs don't always fully enclose that where the umbilicus, the umbilical cord came into your belly. And so if it's not super tightly wrapped, your abs aren't super tightly wrapped around your belly button or where that came in, then what happens is if it's loose and you start having a lot of gut pain, oftentimes you'll feel a bubble because the abdomen can start to seep through the cracks of where your abs aren't wrapping around your umbilical cord attachment site, if you will. All right. And so that's where hernias in general will often occur, is right around the belly button or down by the hip. When your blood vessels that go down to your foot shoot down your leg, your pelvic floor and your abdomen muscles kind of encase this little, try and keep everything tightly wrapped in your abdomen. But when those puncture through to go down your leg to provide blood supply and nerves to your leg, it leaves some holes in there, all right? And it can, if loose, those hernias, you have abdomen or other tissues that can seep into that area where those nerves and blood vessels shoot down the leg. All right, oftentimes you'll be able to feel a little bit if there's a bubble or like a soft fluid area or something like that, you'll be able to often feel this will be part of the problem, because you'll feel that something that creeped through that hole with the nerves is part of the problem, okay? You want to get that fixed soon. If your abs tighten up because you start doing ab workouts regularly, then you have this part of your abdomen that's seeping out next to the nerve or next to the belly button, and then you tighten up the ab, it will stop blood flow to the extra thing that's not supposed to be in that hole. The hole was only meant to be so big for the nerves and the blood. You start pushing more things through it and it tightens up again, then you're going to start cutting off blood supply to whatever else stuck through that hole, and then you're going to have problems, okay? Same thing with the belly button. You'll want to do something similar there. I would say, and I would argue, that if you don't work out your abs, then you will be more likely to a hernia, because as your abs relax, they're going to relax around these holes in the abdomen and create more opportunity for your guts to come out of it. It sounds really gross when I say it like that, but you get the idea. So that's your femoral hernia. You have an umbilical hernia we talked about. You also have inguinal hernia. This is primarily for men because the inguinal hernia happens as the testicle descends into the scrotum when you're a baby. What happens is, in order for the sperm to come up the vas deferens and go into the urethra for ejaculation, there's that tube that kind of helps that travel. That comes up into the abdominal wall, the pelvic floor and abdominal wall. And as that happens and comes up, it's another hole that we talked about that compromises the strength of the abdomen. And so you can also have, that's when men will go in for their physical and they'll have you, the physician will have you turn your head and cough. Turning your head, by the way, is just so you don't cough in the doctor's face. The turning the head doesn't have any significant relevance to that outside of don't cough in the doctor's face. But the cough kind of pushes more force into the abdomen to see if it's going to push more of that intestine into or through that hole. And so that's what they're feeling for. They'll do the same thing with the femoral hernia. If you kind of bear down and you cough and you flex, then it will likely make the hernia worse because you're pushing more force through the hole. All right, so that might make it worse. But any of these cases, definitely get it looked, get it corrected. That's not something I treat in my office, but I just want to educate you of kind of how that works. Those are holes in the abdomen that will be compromised if your abs don't stay strong. And sometimes you can have a six-pack guy that walks in and he has a hernia, all right? And I don't have all the explanations or reasons for that, but that's kind of how it works. We're then now going to get into, we've been going about 30 minutes. We're almost done. I'm glad that you're hanging. Oh, yeah, we got like 2 or 3 more. It's fantastic. Congenital hip dysplasia. Congenital means from birth. All right. If you have a congenital malformation, it's because you were born that way. Hip dysplasia is basically something that happens in infants. If their hip joint does not develop correctly, then it's going to cause problems the rest of the time. I have pictures here that I could show, but the simple version is you wouldn't know this unless you had an x-ray. If your kid can't walk or crawls or doesn't even crawl within the first while of life, let's see if I can actually find out if they give me a good example here. Within the first 12 to 18 weeks, no, that's more of a dislocation. So, yeah, there are a couple of different things they say here. So the first thing is if your baby, if the hip looks funny, it could be a dislocated hip because there was no joint that developed. All right, so the femur is just flopping around in there. It's a birth thing. Of my knowledge, they don't know exactly why it happens. But the best way that they will fix this to date, of my knowledge, and according to this book, is that they'll put the poor toddler, poor infant in like a set of straps or a cast, and they'll just cast the entire waist and the leg, and they'll tie the leg to the hip. So as the body grows, it's in the right spot. And they're typically in a cast or a brace for a long time, just to try and keep the femur associated with where it connects in the hip. And they'll do that as long as they can until it starts to grow better and kind of grab that hip. So that's not something I can treat, of course, just want to educate you on that. There's different forms of congenital hip dysplasia, but the simple version is the femur is not staying attached to the hip bone. And when I say hip bone, I mean pelvis bone. So there are, when people say hip to me, oftentimes they'll look at their SI joint, the sacroiliac joint, and they'll say, yeah, my hip hurts. Well, your hip is where your leg hits your pelvis, all right? It is not on the back of your spine, kind of on your glute area. That is your SI joint, all right? I'll make sure that I bring, actually, I have a little, This is better. So if this hurts right in here where your hip meets your tailbone, that I would not say is your hip. Your hip is where this bone connects down into your leg. All right, this is called your SI joint. We're going to cover that in I think the next episode, because so far we've been climbing up the spine or up the body. So I think we'll cover SI joint and low back next episode. Tune in for that one, because we are now at the end of the hip for the day. If I missed something that you would like to learn more about, please send me an email at admin@straightupchiropractic.org. You are welcome to message me on social media. I'd be happy to cover information. If you've been told you have something in your hip that I have not covered today, I would love to cover that in a future episode. So reach out, tune into our next episode on the SI joint and low back, and I hope you learned something today. That's my goal. Hope you learned something. Tell your friends about it, and share my podcast if you have any desire to do so. I want to help as many people as I can to get educated. All right, we'll see you next time. Thanks for listening.